There's a red button and on the top right-hand corner when you go onto the website. That's got lots of new fact sheets for volunteer involving organisations and for volunteers. It's got the latest information and links to SA Health, NT Health, for you to get the most up-to-date information. So we'll kick off now. I'll hand the reins over to Chris to start his presentation. Over to you, Chris. Thank you very much.
Thank you very much indeed. Can everyone hear me okay?
Yeah, we can hear you.
Yeah, we can't see you, Chris.
Yeah, I apologise for that. I'm not sure what's going on. You'd think I'd be well on top of the technology by now, but unfortunately I'm not sure what's going on. So it's probably a saving grace, actually. You can't see me. But thank you very much for this opportunity to speak to everyone. It's been obviously a massively difficult situation for us as a society, and a lot of the things that we have grown to take for granted over time have been taken away in a very, very quick succession. What I would like to think, though, is some of those very hard decisions that were made early in the piece, we're starting to see some of the gains of those. As people who keeping right on top of the numbers. Our numbers here in South Australia have been kept below in single digits for a little while now. And one case yesterday, I haven't got the latest stats in front of me in terms of what we're looking at today, and it's a bit of a moving feast at times, but it is looking much better than it did, and far, far better than other places around the world where we are seeing quite horrific scenes of suffering. And really, it sort of goes across the board. Across Australia, we are seeing, those sort of cases, numbers of cases start to slow a little bit. But one of the, I guess, things to keep in mind is that can turn around quite quickly, as we saw with some of the clusters that we've seen in South Australia, particularly both at the airport, in the Barossa Valley as well. So, whilst it's looking good at this stage, and I've been thoroughly impressed by the societal effort, it's not just the health system, of course, it's right across the board, people doing the right things, making some significant sacrifices, and it's looking like it's returning results, which is great. I guess one of the key things that I'm now being asked a lot about are things like, when might we look to wind back some of those controls that we've put in place, like social distancing, like the controls and gatherings, and some of the cross-border travel, and as the Prime Minister said yesterday, and he's obviously being very well advised by the Australian Health Protection Principal Committee. A lot of these activities we really need to keep in place for a while longer while we see how things progress. I think we've all been impressed in terms of the public health fraternity at how effective we've been in addressing the transmission of this disease. But again, it's one of those ones that can get away on us quite quickly. So that's really quite a challenge for us, both as obviously a health sector, but right across the board. But it is encouraging to some degree that we are having some of those, thoughts and discussions about what the other side might look like. And of course, as we're going through this, my role, particularly across government, is to help a range of agencies manage as best they can, because obviously there's essential services that need to be delivered as we go on, and obviously volunteers have a big part to play in delivering a lot of those services and supporting people through this crisis as well. So a lot of my time in that regard is around doing things like working through how we implement some of the controls, and also how we help people understand what those controls are and mitigate some of those controls through things like directions. The state has declared an emergency, and the police are, front and centre. The Commissioner for Police is the state coordinator who essentially calls the shots on how things unfold. very ably advised by a Chief Public Health Officer here in Australia, South Australia, Professor Nicholas Burrier. And those measures are essentially to limit the spread of this virus, which is really at the centre of a lot of what we're doing. One of the things that's happened more recently, which is a significant benefit, is that we've actually, through our preparations and our, I guess, compliance with some of those directions and activities, we have had the ability to ramp up both our healthcare system, but also our testing and contact tracing activities as well. So we really are in a very good position here in South Australia to manage the disease. And that activity, that sort of suppressing of transmission that we've all played a big part in, has actually put us in this position where we are able to take stock on what's actually gone before, build our capacity in terms of both the healthcare system, but as well as our testing system. And really we are in quite a good position now to, if we do see increased numbers of cases, to manage those, which is very encouraging. And as people would have seen with what's now being termed the Blitz around testing, we do have an opportunity to cast the net a bit wider in terms of the people that we test. So people may have picked up through the media that the testing criteria is a lot broader. Now we do actually have the capacity to test a lot more people to get a better understanding of how many people may have the infection, but are asymptomatic or have very mild symptoms. We're not anticipating that this will uncover a large number of cases. We think that we've got a very good understanding of what's happening in the community, but it's better to find out and confirm that, and that's exactly what this Blitz is trying to do. So over the next 14 days or the next 2 weeks, there'll be that expanded testing going on, and we'll look to see what's happening in the community. Of course, respiratory conditions, colds, flu, things like that, they are common. And we think that that's probably the vast proportion, but we have all been very sensitized. A cough in the office now sends everyone a bit spare, and that's understandable. It really is a very sensitive time for all of us. So over the course of the next 2 weeks, not only will we see the results coming through from that testing, and those testing numbers have gone up very significantly. I think we had something like 900 tests done yesterday. There is capacity to do more, of course, and we will. But also we'll see the impact of events of, across Easter and some of those holidays as well, to see if, that the social distancing and everyone adhered to it really quite well. But of course, those sorts of occasions, even with that sort of limitations on gatherings, they are family times. They're times we want to get together. So again, we're sort of, watching carefully about, what might manifest itself over that time. So really, I guess like I started with, we are very much in quite a good position here in South Australia. That's not to rest on the laurels and think that the job is done. There's still a long way to go, but all the indications are looking better than they did, which is encouraging. Of course, we don't want people to think that it's all back to normal. There's a lot of monitoring to go and to understand what's happening. One of the things I think is encouraging around this opportunity, and I'll perhaps look to finish on this, is very much about having a chance to think about the broader implications of some of these restrictions that have gone on as well. So we're very aware that things like mental health, social supports and those sorts of things, which are so critical obviously for our well-being and functioning, have been impacted. It has been a very anxious time right across the board. And those are the sorts of things that we're looking to to help with as we go along. And I think that's perhaps one of the most important things. We have some of our most vulnerable people, of course, are most heavily affected or are most vulnerable to these infections, and we need to keep them very much in mind. We're also, we may have seen in the media today, we are a little bit worried as well with people not coming forward for things like normal treatments or for their normal, perhaps not normal is the right word, but for existing conditions as well. So again, I think now that we hopefully have got a degree of understanding and control, we can start to look to address some of those other things which are really just as important to manage too. So Evelyn, I might leave it there and hand back to you, and then we can perhaps take some questions.
Thank you, Chris, very much for that information. That was very informative. What I'll do is, before I jump to the questions, I'll get Evelyn to do her part of the presentation, and then I'll read out the questions. So keep putting your questions up, and what we'll do is we'll read them at the end, and there'll be plenty of time for questions and answers. So please keep putting questions up, and I'll hand over to Evelyn now. Thank you.
Thanks, Rachel, and thanks, Chris. It's yeah, certainly we've had to change the way we work as a sector, and in some ways, even though there's been some terrible stories with people passing away and people being infected, the community spirit and the giving of people and people's goodness has really come to the fore. And we're very lucky that, in South Australia and the Northern Territory, we have a volunteering SA&NT has an active part to play with the registering of spontaneous volunteers in these types of situations. And to see the outpouring from people who really want to help, it's fantastic to be part of a sector that is so caring and wants to give. So volunteering SA&NT have been busy with trying to provide as much information as we can, particularly with organisations, volunteer involving organisations who've got programs with volunteers who may be at risk. Should they suspend their programs? Should the program still go ahead? What happens around service delivery? What happens with our contractual obligations when we get funding? How do we deliver those services? These are all questions that people have been asking. What happens with people that have got mutual obligation requirements through the federal government and their roles if the volunteering role is suspended? So we've been working with our state and territory counterparts in Volunteering Australia really very well and very proactively to get consistent messaging across. And some of the things that we've been looking at particularly our fact sheets that we've been putting out. And if you haven't come across these, if you go to the homepage of our website, which is actually on the background to my slide at the moment, you'll see on the home screen there is a couple of COVID-19 places that you can click into. One is where the resources are, and I'll just put some of them up. Maybe if no, I've disappeared completely. Oh, that's easy to do. I won't do that because that's not going to work. But anyway, there's a whole lot of resources, staying connected with your volunteers, diversifying your volunteer program during coronavirus, looking at communicating with your volunteers, how to get trusted information from the authorities, what happens around social distancing and hygiene practices for your volunteers and volunteer programs. And then also looking at more positively diversifying your volunteer programs, creating new roles. But the other piece that of work that's been going on is a policy piece with Volunteering Australia and our state and territory counterparts, where we've actually put a position paper out around the safeguarding of volunteers and volunteer involving organisations during the pandemic. They're all on our website if you click on the resources. But also, if people that you know want to volunteer, you can also do that by registering on the homepage of our website, filling out details, whether you have working with children check or driver's license or any other pieces of information that will help us to match you to roles. At the moment, there aren't a lot of roles, but I think that the issue around wellbeing, particularly for people who are socially isolated and or older who have not connected into existing services, And I think that there are a lot of people in that group. I think that those roles for volunteers will probably become more apparent as time goes on, depending on how long the restrictions will go for. So I really want to put a big shout out to all the managers of volunteers, all the volunteers, those who are at home not having a role at the moment. We understand that that will be probably not what you're wanting, but really say thank you to everybody for pitching in and really working hard to change the trajectory of the virus in South Australia and the Northern Territory. In many ways, we are truly very lucky compared to other countries, and that's credit to everybody in our communities. So probably enough of an introduction about the things that we're doing. Oh, and just to say one more thing, sorry, I should have mentioned that we are holding a volunteer managers network meeting, and that will be online, and so volunteer managers can provide peer support. We've got a number of sessions booked. That's on our events page of our website as well, and that's coming up. And really we want to just keep connected to you, to support you, to answer your questions, and if we don't have the answers, to get you the information that you need to be able to make decisions. You know, questions like what happens if one of my volunteers contracts coronavirus, you know, what are my obligations as a program manager? All of those sorts of questions are really can be quite complicated and tricky, and we are here to support you and work with you to find the right responses. So thanks, Rachel. I think if everybody's happy, we'll can go across to some questions now.
Yes. So I've kind of catalogued the questions. I've grouped them together. So I will just start reading them as I've grouped them together, and I hope everyone's questions will be answered through these questions. How many days after exposure to COVID-19 can you test positive? I guess this one's to you, Dr. Chris.
Sure, and it's a common one. Look, it really depends. There's been a lot of discussion about what the average incubation period is. It's usually about 6 days or so, but it can range from 2 to 10. And one of the things that's come up quite a bit recently is discussions around rapid testing, which is the pinprick ones, which test the levels of antibodies in your blood as a possible way for people to find out really quite quickly whether they have the condition or not. Unfortunately, at this stage, that's probably, well, apart from actually being prohibited here in South Australia, and I should apologise as well, because obviously you have Northern Territory folk here as well, and I can't speak to that, the situation in as much detail up there. But you know, really that the testing side of things is quite critical, and the tests that we're doing at the moment, which are the PCR ones, which are the swabs, which are a little uncomfortable, but they do the job in telling you whether you've actually got the infection or not. That's the best way of doing it, but what we do encourage people to do is inform themselves about you know, what testing actually can and can't tell you, because we are also seeing a lot of people say, for example, looking at, okay, well, we're looking at testing perhaps to you know, exclude people from things or include them from things, and the tests themselves, whilst they're good for identifying the infection, they're not very good in terms of a predictive test, if you like. So we've got a testing fact sheet on our website, which I'd recommend people getting along to, because that gives you a lot more of that information you might need about what they can and can't tell you, and what sort of situations you use them in.
Great. We will get that up onto our website as well. Here's another question: is it true that more people have died from the flu this time of the year in South Australia than they have from corona or COVID-19 this year?
Yeah, look, I haven't got the flu stats in front of me. I know it's actually a bit quieter flu season. It's always a bit tricky making some of these comparisons between diseases because they are, you know, they do behave in different ways. One of the things that people are struggling, I am too, for example, around, you know, coronavirus and children. You know, it seems counterintuitive, for example, that, you know, we children are a very good way transmitting most diseases, but they don't seem to be in this one. Flu is one thing, obviously, that's playing on our minds quite a bit. The strong encouragement to get the flu vaccination, because thankfully we do have that. To prevent that, we were particularly worried about the flu season and this coronavirus coming together and causing all sorts of mayhem. The social distancing and all these other things that we're doing at the moment work for a variety of diseases, so hopefully we're seeing less. But it is sort of getting back to the point about comparing between flu and coronavirus. It is a very tricky sort of one to make. Flu does kill people, and that goes without saying, but fortunately we do have the vaccination, the immunisation there. It is effective, so we do encourage people to you know, if you're particularly in a risk group, to get it as soon as you possibly can, but for the rest of us as well, to make sure that we have that, so we can, you know, there's one we can sort of take care of.
Okay, so the next one is, if we have a volunteer that is showing symptoms, should we be insisting that they go and get, or should we be requiring those volunteers to go and get a COVID-19 test if we have someone that is showing symptoms in our program?
Yes, until sort of middle of this week, I would have said it's best for them to obviously get advice, but they may not qualify for a test. But now that everyone has those symptoms, they can get a test. And really they should get along and be assessed first, and then they can get a test done, so that's fine. Really, like I said before, and one of my colleagues' favourite sayings is common things are common, which is tautology, but anyway, you know, it's more likely to be something else, but by the same token, you know, for that level of assurance, probably the key thing I'd say is, you know, why are you here if you are sick? That's one of the key things that we're trying to prevent. I know people tend to be a bit stoic with things like colds and those sorts of things. Right now is not the time to present yourself. So if they are sort of ringing up to say that they're, you know, not well or they're symptomatic, then you can advise them to, you know, the availability of the test and seek some advice. Call ahead first, of course. We do have our coronavirus clinics right across Adelaide, and again, apologies to the MT, I'm not quite sure what the situation is.
We do too.
Brilliant. Well, then that's excellent. Then I think that's the way to go. But again, it's, you know, that what we call presenteeism, or people turning up to sort of soldier on, we don't want to see that anymore. I think it's very much around if you are sick, and this is the sort of the front end advice to people if they are sick. Don't show up, you know, we'll you know, the best thing that they can do is get some medical advice and perhaps get tested.
And Chris, as a workplace that may have employees and volunteers working in the workplace, does the employer or the workplace have some rights to insist that those tests are done, or to ask people to not present to work?
I think in terms of asking people not to present to work is the key one. In terms of requiring tests to be done, I'm not sure that that's possible, but I'm not 100% certain on that one. That could be one that people might seek some independent advice, but it is very much one thing that we are constantly saying, because, you know, particularly with both, you know, people in the volunteering sector, but also people in care, you know, jobs, we have seen people turning up to work symptomatic and infecting people, and we've got the situation in the news in New South Wales, for example, where, you know, someone turning up to a workplace, and this one was an aged care facility, and infecting 20 other people, and that's, you know, not only you know, a highly risky thing, but you know, I'm sure if, you know, the person had a conscience, they'd be devastated that they'd actually, you know, caused that level of you know, suffering. So it is one of those things where you know, it's a problem with a range of infections that we see of people soldiering on. It's not something to do. I think we've got a good work ethic in Australia, but you know, you can take it a bit too far at times.
And part of the issue with people presenting at work is if your organisation fits under the work health and safety legislation, if it is a PCBU, it employs people and has volunteers working side by side, then there are quite clear regulations and laws in relation to work health and safety that you can't put your workers in harm's way. And therefore, in those situations, I would have thought it would be absolutely imperative that if somebody was presenting unwell, that you could ask them to not put others into harm's way inadvertently, or or possibly they may or may not be unwell with COVID-19, but certainly your duty of care to everybody in your workplace should be, one of the highest priorities that a workplace would be looking at, I would have thought.
Absolutely.
The next lot of questions, I'm just going to summarise them. What are your thoughts on the different states reducing social distancing requirements earlier than others? When do you think that SA's social distancing, when the restrictions will be lifted, and for how long? And should children go back to school?
Okay.
Dr. Chris.
I'll start with I guess one of the key things is with the states, we've seen a whole new system set up with the National Cabinet coming together to try and to tackle the coronavirus situation. And now we've got the Australian Health Protection Principal Committee reporting directly to the National Cabinet, and they're all the chief health officers. Essentially, it's to try and to get uniformity as much as we can around a range of issues, but we need to also, I guess, balance some of that with states are in very different positions in what's happening within their borders. And I think, to be irrationally consistent, it wouldn't make sense. And also the community support perhaps wouldn't be there. So places like South Australia and the Northern Territory have elected, based on their individual circumstances, to take different approaches. Because one of the critical things with this is obviously to try and be sustainable as much as possible in how these measures can be employed. And that's, a fine balance between, controlling the transmission of the disease, but also letting as much societal functioning go on in as much as that can under these circumstances. So, for South Australia elected to maintain the, limiting gatherings to 10, and other states have gone down to 2. We've had a bit of confusion, which is always a bit tricky, with some people thinking that the 2-person rule applied here in South Australia, for example. As we go along, I think, that's where we start to look at, refining how some of these things are done. And again, I think states will move differently depending on their local conditions. But again, the intent is there to control the transmission. How we do that, can change from state to state. So, NT, South Australia, WA, doing, and Queensland doing some border restriction type activities. Because we had other states on the eastern seaboard with high levels of community transmission, that made sense to do, is to try and reduce the amount of cross-border traffic that might bring in some of the infections. And then, as time goes on, I think those border restrictions will probably be some of the last things to go. That's just my personal opinion. I think state by state we'll see people reassess over the next 2 to 4 weeks about where they stand and what they can possibly do. And there is a lot of thinking going on, as people would be aware, at both a national and a state level, about how we do this in the most sensible way possible, because the last thing we want to do is have a situation where we essentially take the controls off and then have to put them back on again. That doesn't help anyone. So I think people appreciate that. So it's about how we do it in the best way possible, and we slowly sort of work our way back up without causing more problems. We also buy more time to get better set up to deal with anything that might occur as well. On to schools. A red hot topic both here at my office and home. It is one of those counterintuitive things. I am very supportive of schools opening up again. I think it's it's essential. I think from a mental health and wellbeing thing, particularly for children, it is critical. Also, the science would back it in terms of having essentially what appears to be the reverse of what we normally see. And like I say, children, and I've got twin daughters. When they were younger, they were very much a source of disease for the family. It had come to school and then it'd come home. But really what we're seeing in terms of coronavirus in children is not that. Now, I totally appreciate, and we're working very closely with the education department around concerns around teachers and also support staff and those people who work in those settings. The Chief Medical Officer was talking about that very issue about, concerns about, contracting disease in the staff room and things like that. So it is a very fraught issue, but I think it's a very important one that we look to get schools back to functioning, not least because they are not only education facilities, but they are also, I think, a key in societal functioning. But they're also, and I'm doing a lot of work at the moment with people like child protection and youth justice as well. They are so critical for supporting some of our most at-risk children in the community as well. So it has been intensively looked at, and obviously it's a very taxing issue and one that does appear to be a bit counterintuitive, and I know and I can totally appreciate why people struggle with it, but I'm very supportive of it, and the Australian Health Protection Principal Committee is very supportive of bringing schools back on and that face-to-face learning. There are some controls that can be implemented to reduce risks. Some of those are, just again, the social distancing, the hygiene, the cough etiquette, and keeping people out if they're sick. But yeah, I think as one of the key steps that should happen.
So the next one, it's a bit of a volunteering one. Volunteering is so important to health, mental and physical well-being. How can we continue to provide opportunities for volunteers without being seen as irresponsible?
That's a really good question. We're currently looking at a risk matrix for volunteer roles that Volunteering Tasmania has started the work on, and we're going to be working with the SA government to sort of progress that for the South Australian context and also the Northern Territory context. We're hoping to progress that as well, to give some guidance as to what roles maybe are more essential and what are the risk parameters and the things that you need to take into account. Obviously, if you go back to the principles around work health and safety, that you can't put anybody in harm's way, then you really need to have, as your most paramount objective, is to keep people safe. And the difficulty is that you want to make sure that programs for vulnerable people particularly are not suspended and services continue so that people aren't even more disadvantaged than they already are. But really, if you haven't signed up to our newsletter, I suggest that you do that, because we'll be promoting anything that comes out in relation to how to make your volunteer roles or make assessments around your volunteer roles and the risks associated with essential or non-essential roles. That'll be all promoted through there, and hopefully that answers that question.
Thank you, Evelyn. This is for you, Dr. Chris. What are the key risks for a volunteer organisation to assess when considering reopening their activities?
Okay, it's quite a wide-ranging one. Really, I think you obviously got to think of both sides, essentially the volunteer as well as the person that's being provided the service. We've got quite a bit of information on I guess, things like the social distancing activities and those sorts of approaches. And also the Australian Health Protection Principal Committee has identified particular groups that we're most concerned about in the community, and they are people sort of over 65 with comorbidities, etc. And that from my understanding of some of the sector is that that people may well fit that category, and really it's around some of that risk assessing and that type of work. We've done a lot of work with people like child protection, like the residential aged care sector, and essentially it's looking at tasks, and this is not rocket science by any stretch, and essentially is there another way to do them in line with some of the the measures that we've talked about. Essentially, ideally, if you are in a position to change your delivery method, so there is that degree of distance, that's one thing you can do. But also we recognise that that's not going to work in a range of circumstances as well. There is those, that close contact which is required. Over time, we're putting out advice around things like, personal protective equipment and what's the right thing in the right setting to actually to wear. We get a lot of questions, as you might appreciate, about masks and things like that, and gloves and that. Really, in the situations that we are in our state and territory, I think whilst those social distancing precautions and some of those sorts of things are important, we haven't reached the stage like people probably be aware in New York they're talking about everyone wearing a mask or something like that. We're nowhere near that sort of thing. So it really is quite a sort of a context specific thing, but the underlying one is essentially if you can look at some of those social distancing type principles or have those thoughts and minds, and then think about them in varying contexts. One we get a lot, for example, is transporting people in cars, and what about if someone's a possible case or something like that. Again, we've got some advice on that, and I should say as well, we'd be very happy. Of course, we can't perhaps manage questions from everyone in the volunteering sector, but volunteering SA&NT, if you wanted us to have a look at anything that you're developing, we'd be very happy to do that. We do have infection control experts here that we can look to assist with some of those sorts of things, particularly in tricky contexts. Like I say, if we have people who drive buses, or if they transport people in cars, or they're required to make close and routine contact, we can help with that risk assessment process and provide some advice around that. So
yeah, that would be excellent, Chris, because some of the examples that are coming through to us are quite tricky, particularly when some of the services are essential, like ambulance services in regional and rural areas that are provided by volunteers, for example. So we can certainly funnel through, and we should have actually said, maybe Chris, that both you and I are part of a not-for-profit intelligence gathering and issue gathering forum that meets weekly. So people can send information or issues that they've got through, and I can raise them and we can hopefully find some answers, as you've mentioned already.
Yeah. So the next question is, what type of communication do you recommend we use to maintain contact with our volunteers and keep up some momentum so they don't drift off in the meantime?
Well, our fact sheet on staying connected with your volunteers has got some really, really good ideas. I suppose one of the key things is just to, how would you like to be communicated with if you were, if your program was stood out and you had your role where you were coming in and being part of a team had been suspended? It's keeping the communication honest and regular, and talking about what the restrictions mean, when you think that the program, might be able to be to restart again, maybe sending a video, picking up the phone. If people don't have internet access, dropping them a little card, a note to say, I'm thinking of you. I think it's really just important that we do take the time to acknowledge that people may be upset or confused or worried. These are all normal responses to an extraordinary situation that none in our lifetime, I think, have seen before. So, you know, keep in touch regularly. I know at Volunteering SA&NT, we're keeping a spreadsheet of all of our contacts with all of our workforce, our volunteers, because we've got a couple of hundred volunteers as part of our own organisation. And so we don't, you know, if we leave a message, that we then follow up and that we've actually got a record that we've done that. You may want to have some social activities online. Somebody the other day was talking about a jigsaw puzzle group. You know, there are plenty of online jigsaw puzzle websites where you can go and maybe have a little, you know, team that, you know, who does the jigsaw puzzle the quickest. I know that that's just a light-hearted thing to do, but there are morning teas and lunches and shared experiences for online to try and be as inclusive as possible, understanding that people are you know, a lot of them, particularly in the older group, can't leave their homes for very many things at the moment. And so that would be putting massive restrictions on them. But look at the fact sheet as well. There's a lot of suggestions on there too.
Thanks, Evelyn. The next question, it's in two parts. The first part is, if our volunteers are working with vulnerable people or high risk groups, should we insist that they get a flu shot? And if we are asking volunteers to get a flu shot, should the organisation pay for that flu shot? And should we be asking our older volunteers or offering our older volunteers a flu vaccination as part of the program?
Chris, did you want to answer any of that?
Well, I think, you know, our recommendations are clear on, you know, we do recommend, particularly people working with the vulnerable, to get a flu shot. I understand as well, you know, that's easier said than done in some circumstances where people might not be in a position to either get it through an agency or, you know, having to pay for it themselves because it's not funded, you know, by the Commonwealth. So, you know, strong recommendation is to do it, and not least, you know, to protect yourself and your family by getting the flu shot. I can't comment on you know, various groups' ability to support that as a program. So, Evelyn, perhaps over to you on that one.
So, you know, if you're directing your volunteers as part of your workforce to undertake activities that then put them or the clients into a risk group that you may want to have the flu shot done, then I would think that the organisation may have some responsibility to pay for that, because you are actually directing that work be done by that particular volunteer or group of volunteers. So, for example, the National Standards for Volunteer Involvement do have as recommendations that volunteers are not out of pocket for expenses that they may incur. If you're specifically asking volunteers to have a flu shot, then I don't think it's unreasonable for that to be paid for by the organisation. Now, of course, we all know that that's easier said than done in some situations, and often the volunteer budget or the budget for reimbursing volunteers is minimal, and decisions need to be made around that. So really it is a policy decision of each organisation that you would need to take up with your management or the CEO to actually understand what the parameters around that would be.
Thank you. Dr. Chris, how long should people who actually have COVID-19 be excluded from activities for? How long do they remain contagious for?
Again, it's a little bit hard to say. It depends on the case. What we have been generally saying is, you know, I think it's around 10 days after symptoms have ended. We don't necessarily recommend people get a clearance test. We are recommending it for our healthcare workers and some people in the aged care sector as well, about 2 negative swabs. But really it's around that mark, and for most people, you know, because here in South Australia, and again I apologise for the Northern Territory, it is a notifiable disease, so there will be some degree of checking in. We've got a system that's set up to check in on people, not only to keep them isolated, but also to monitor how they're going, and also to let them know, you know, when it's safe to resume activity. So there is a lot of what we might call a wraparound of services around that, so people aren't left guessing. In this particular case, the majority of our cases are actually, at home, which is, a reassuring thing. But by the same token, obviously we've had some very sad deaths, and also some people who have been very, very ill in our ICUs. So again, it's one of those ones where essentially the system will help support people, make those decisions and assessments. I know some employers and some groups are actually asking for clearance certificates, but essentially once you've been given the okay by our our COVID specialist GPs, you should be good to go.
Okay, so the next one is this two separate questions, but I'm going to put them together. So one of the questions is, we have a men's shed and a few of the volunteers would like to come in for a cuppa and a conversation for half an hour. They'll be outside and they'll keep their social distance. They're feeling a little bit isolated. What are your thoughts on what are your thoughts on responsibility? And the other part to this question, which is from someone else, is how likely is the virus, can it be passed on if it's an outside volunteering situation where social distancing is maintained? So I guess really that's the question. How likely is it the virus can be passed on when we're outside in a volunteering situation?
And look, I think the key thing is we are encouraging people, to limit the amount of, gatherings or work outside. So it is, that's a difficult thing to obviously adhere to. With the social distancing, really the formulas around that, whether it's 1.5 meters or 4 square meters, keeping that distance is really around, reducing that risk of transmission, because, from what we understand, it is a droplet spread. So, when we talk, we exhale moisture, and if we do have the infection, we could be doing that with the virus itself. I'd recommend, outside, I know that people sort of, struggle a bit. It is good to get out. One of the recommendations is to get out for exercise. So there is, opportunities around that, of course. Maintaining that social distance, because it is so important, just to reduce that risk. And really, this is what this is all about, is, the limitation on the gatherings, the recommendations around social distancing is really there just to, protect all of us, reduce that transmission. So hopefully we can sort of get from this suppression stage to the elimination stage and take care of it. So again, I think in those sorts of situations, it's, I think, like Evelyn talked about before, reaching out, are there other ways of doing it, whilst we get a bit better handle on what's going on in our community. And of course, if people need to get out and exercise, maintain that social distancing, so we can reduce that risk of transmission.
Thanks. So a few more questions to go. I'm going to put these two questions together as well. Are there any forms of support for volunteers that may be struggling with the lack of volunteering opportunities? Now that's come from Hannah from the Northern Territory. And then the other one is, what type of roles can volunteers do from home for organisations that are thinking, we've got volunteers, don't know what to do with them because they can't do their normal volunteering for us?
So just to answer the first part first, what support is there for volunteers? Is that?
Yes, correct. What form of support for volunteers who are struggling with the lack of volunteering opportunities?
So I would ask that of the organisations that are utilising the volunteers, what they are putting into place themselves, because I know I volunteer for a number of different organisations, and if I was suspended from those volunteering roles, I would like to know that I'm just not going to be called on when everything goes back to normal and I've had no contact in between. I want to know that people would value me in the downtime as well as in the times that I'm volunteering for that organisation. So I think the onus for support of volunteers predominantly goes to the organisations that are utilising those volunteers. There is a lot of we do have information and fact sheets for volunteers as well about their rights and what they can expect and what they may wish to think about their own protections. That's on our website. but also I know that government agencies like Wellbeing SA, and I'm sure there's an equivalent in the Northern Territory, are looking at all of the wellbeing of all community members, volunteers and people that don't volunteer, employees, to be sure that mental supports are there. I know that people have been reaching out through the Black Dog Institute and Beyond Blue and Lifeline and all of those organisations that we know are there every day, but I know a lot of them have increased their service provision because of this extra supports that are required. So link in with your volunteers, check in on them, see how they're doing, tell them you miss them. I think that's really important, that they are an integral part of your workforce, even if they're at home at the moment, not undertaking any formal role, that you're looking forward to them coming back into the workplace, and check in on their mental health, and connect them into services. Those services are there. We're very lucky in Australia that there is, and the federal government has announced a lot of funding and extra support. And I know here in South Australia, Wellbeing SA is looking at all different measures that they can roll out to support communities across South Australia. And as I said, I'm sure the same would be the case in the Northern Territory as well. And types of roles that people could do, we've just got on our fact sheet, I mean, there'll be many, many more than this, but editing or writing proposals, press releases, reviewing your website, getting somebody to help with rewriting content for that, managing and increasing your social media posts, creating new course content for training, maybe one that you've thought about doing for a long time and haven't had the time. Get people involved to translate documents into other languages, review and summarise different reports that you might have been needing to do. Get some grant applications going, or get volunteers or other people in your organisation to help with grant applications. Heavens knows we all need the funding. You might want to design a database or get people out there to help you to improve your administrative processes. Policies and procedures, always put on the back burner, bring them to the fore and review them. Develop some videos. These are just some of the things that you could ask volunteers to do, or podcasts, or even create a project management plan for a new project. People are wanting to volunteer, and don't forget, you may want to look outside your existing pool of volunteers. As I said, that we've got people that have already registered to volunteer to support the pandemic. We can send roles to them and they can connect in with you. We've got hundreds and hundreds of people who have registered, who are waiting, and are a lot of them in the non-risk groups that can support your organisation with different roles and different work that needs to be done at this particular time. So get in touch with Volunteering SA&NT. And I mentioned earlier our newsletter. You can actually, if you haven't already registered, you can get to that through our contacts page on our website. Venues comes out every fortnight. There's a Northern Territory edition and a South Australian edition. And it really does provide the most up-to-date information for volunteer involving organisations and volunteers.
Yeah, and I just, Jonty has written here in the chat section that they've adapted some of their programs to online. So volunteers are assisting students with homework via Google Docs. So an English conversation group via Zoom is another one that they've done. So thanks, Jonty, for that. The last two questions I'm going to ask is, my understanding is that we are legally required to offer flu shots, back to flu shots, for volunteers who work in the aged care setting. Is this true? We have looked at this for volunteers in my organisation and it is not in place, only for staff.
I don't have an answer, but I'm happy to take it up unless you've got an answer to that one, Chris.
The only thing I would flag is one of the requirements under the direction for access to aged care facilities that was put in place in South Australia requires flu shots. So it would be an important thing to investigate the provision of that, because that could mean that people can't access those facilities in South Australia without having had that one. So Evelyn, happy to work with you on that one to check with our immunisation section to make sure that if people are entitled, they can get those shots.
Mal White has said that the answer is yes, flu shots and aged care. So now the last question I have for you, sorry, I've lost it. This is from John. Our volunteers, SES, need training for emergency response, but it's all face-to-face training, which is currently banned at present. How are others onboarding new volunteers, and particularly around, I guess, that face-to-face training that emergency services volunteers need? What's the way we get around that, or how do we deal with that in this present time?
Chris, did you have any examples of people that are needing to continue training that can't be face-to-face?
We do. We have had requests for exemptions come through under some of our directions around some of those gatherings. And essentially what happens with those is they come through to our State Control Centre Health, where they're reviewed by both the health department and the police, because the police are the ultimate decision makers in the circumstances we have here. So what I would recommend people do is if they're looking to do something like that or seek an exemption, really it's about the activity and why it's important, which sort of goes without saying, but also how they're going to manage some of those other risks that, other activities such as maintaining social distancing where that's possible, hygiene facility provisions, those sorts of things. So really it's about sort of painting the whole picture about what you need to do and how you're going to manage some of those risks. So that assessment around whether there is an entitlement to an exemption can be appropriately looked at. I'm not so sure about the emergency services thing, whether they do have some degree of existing exemption, but perhaps I can take that one on notice and get back.
Great, thanks.
Yeah. I've got two last questions, and I'm not sure either of you can answer them, but I'll ask anyone. Mutual obligation for Centrelink is currently on hold to the 27th of April. Is that likely to be extended?
I'm not nodding my head because I know anything about whether it'll be extended or not. I know that Volunteering Australia is pretty much every day lobbying and advocating for that to occur with the federal government. We're acutely aware that that date is fast approaching, and there are so many impediments to people under mutual obligation requirements if they're self-isolating, if their programs have been suspended. So it is a watch and see. And as I said, if you're connected into our VNews newsletter, that information will be provided in there to all people who register for that as soon as we have any further information. But we're definitely lobbying very hard on that one.
Okay, thanks, Evelyn. And the last one is, with talk of the tracing app that's been in the news at the moment about the app that's going to be on the phone, how will people who don't have smartphones be contacted, contact trace if they don't have that? This person, which is Anna, she works with older senior volunteers and they don't have smartphones. Is that still being worked on, or is there an answer to that, or?
It's the way we've been working for years. So essentially the app is like a lot of the developments that have happened very rapidly in this space to enhance what we're already doing. So essentially what happens is if we do get a case, essentially it triggers an investigation, and we have our contact tracing team, which has recently been greatly expanded, who essentially do the sleuthing around where that person has been both 24 hours before their symptoms started and sort of in the days that follow. And really they track that person through, identify where some of those links might be. They go through possibly organisations as well to identify who might have been in contact, and then advising them accordingly about what might have gone on. So really that's very much a manual process at the moment. What the app's looking to do is to automate some of those sorts of things. So essentially through the tracking through that particular app, those connections can be drawn quite quickly. But one of the reasons why we have increased our capacity so significantly, it is so important to act quickly on those initial notifications, and it is very much a manual process. So we do need a lot of people to actually do that and follow that through, make those contacts, find out what went on, talk to people about what's gone on so they can understand that risk, and we can identify who we need to, to manage and who perhaps isn't at risk and can be excluded.
And they're doing a super job, Chris. And so, we really thank all of the frontline workers and people in government and in the not-for-profit sector and volunteers, everybody that's got an active role that's done a super job to get our South Australia and the Northern Territory to be in this great position of reducing the curve of corona infection. So we thank everybody for their great work.
Yeah. Working very hard.
Okay, well that's it. I hope I haven't missed any questions. I was trying to summarise them all there. I just will say, John with SES, Tamara from St John's is saying now St John's are now offering non-face-to-face first aid courses. So that sounds like maybe we need to get all our frontline emergency service kind of workers together to talk about how we progress that. But anyhow, that's it for today. Thank you everyone for logging on. Thank you so much, Chris, for taking the time out to answer our questions. It's been fantastic, and we're getting lots of great feedback on the chat thing saying thank you very much. And thank you, Evelyn, for also doing this. And thank you everyone for attending.
Thanks everyone. Stay safe.
Thank you. Wash your hands, social distancing. Thank you everyone.
Bye-bye.